Hello. How are you doing? Thank you so much for joining me today. Oh, how am I doing? I'm sick. Once again. Which is why I felt like it's appropriate that maybe today I react to one of the best, if not the best, healthcare systems in the world. At least that's what I hear. It's not the American healthcare system, no. It's the French healthcare system. That's what I heard in a video. That it is maybe the best or like tied with Japan. Something like that. I don't know. I mean, it's hard to quantify these things, exactly what's the best. You know, a lot of healthcare systems are the best at something. Like here in America, ours is the best at bankrupting you. Now, how the French healthcare system works, I don't know. I'm guessing it doesn't cost $3,000 to get an X-ray or an ambulance. No, an X-ray doesn't cost $3,000. I don't wanna lie. An X-ray probably costs like $1,500. Anyway, with no insurance. With insurance, maybe only a couple hundred. Anyway, only. The healthcare system of France. I really am sick. Oh man, I'm trying to keep it in. I'm not gonna cough. Healthcare Triage. Go check out their channel, link down below. Okay, we're good. Let's do it.
There's a saying I'm quite fond of, although I'm not sure who first penned it.
I don't know why I didn't
I
didn't expect a human to pop up on screen. You really scared me there.
Their healthcare system and change it all the time. Here in America, we hate ours, but refuse to touch it. There's some truth to that. There's also a lot that much of the world can learn from France.
That's true. Everybody here, rightfully so, bitches about the healthcare system, but it's like, I mean, what has changed? Obama changed it a little bit, barely, and I don't know. I'm pretty sure it's Trump undid some of that stuff, so nothing's changed.
Their healthcare system is the topic of this week's Healthcare Triage.
I'm going to turn off the captions. I can't deal with the captions.
Toward the end of World War II, the French realized that their country was in pretty bad shape. There was little chance that the shattered private sector was going to be able to take care of all the people who might need healthcare in the next few years. So France established...
It's really interesting to me as an American thinking about how after World War II, so much of the world was in shambles. You know what I mean? Oh, I'm sorry. I was trying not to cough. You know those videos, try not to laugh? This is try not to cough. Anyway, it is interesting to me to think about how, you know, the world was in shambles, and it wasn't that long ago. Because America was relatively untouched, so I don't think about that very often.
A system of national health insurance in 1945. Their system is, ironically, for those of us in the United States, known as Social Security. Everyone in France must pay for mandatory health insurance.
The French would be really disappointed to figure out what Social Security is if they came here to America, you know. You don't get any benefits. You pay into it your whole life, a significant part of your paycheck, and you don't get anything until you're like 65. And even then, they keep saying that by the time we're that age, it's going to be canceled or something.
Insurance is obtained from nonprofit funds. There really isn't any competition, and there really aren't many choices. There are 5, known as general, independent, agricultural, student, and public service. One fund alone covers almost 85% of all people in France.
General?
I'll give you 3 guesses which one it is. They all have pretty much the same benefits and the same reimbursement. The only people who don't fall into one of these 5 funds are people who've never worked or aren't covered by other sources. For those people, the government has its own plan, financed by taxes, that reimburses better than the other funds for people like the very poor who can't make out-of-pocket payments. These funds are financed largely by the public. More than 40% of healthcare spending is financed by payroll taxes.
All right, let me just see here. Okay, payroll taxes, income taxes, and tobacco and alcohol taxes. It kind of makes sense since that stuff is harming your health, that would fund the healthcare.
And about 1/3 from income
And I know a lot of French people smoke, don't they? A lot of Europeans smoke.
taxes. The rest comes from tobacco and alcohol taxes, some transfers from other branches of Social Security, and a small amount from state subsidies. Altogether, this covers more than 3/4 of all healthcare spending. This insurance covers a lot: inpatient and outpatient care, specialists, dentists, midwives,
Dentists? That's kind of unique, isn't it? I mean, I don't really know. To be honest, it sounds kind of unique.
diagnostic tests and services, prescription drugs, medical devices, mental health, even health-related transportation. Stuff
Mental health, what's that?
we'd never consider covering in the United States is included. Things like homeopathy, house calls, amazing maternity benefits, and even childcare. Social Security covers
Child care? Now I'm upset.
somewhere between 70 and 80% of costs, leaving
That would be so helpful.
the remaining amount in individuals' hands. But there's also voluntary health insurance provided by private insurance companies or from the government for those who are poor. This insurance covers many of the costs that Social Security doesn't. More than 90% of the French have voluntary health insurance plans, mostly through their jobs. Almost 70% of
But I thought he said it was only for the poor. So why does 90% of France have it?
primary care physicians, and more than half of specialists are self-employed. Again, France is not socialized medicine. About 2/3 of hospital beds are owned by public
That's really interesting. I assumed it was like the NHS.
or nonprofit groups. The other third are owned by individuals or corporations and are totally for-profit businesses. Doctors make much less than those in some countries, maybe 1/3 of what doctors do in the United States.
Oh my
But they get
gosh.
medical school for free, and they pay nothing for malpractice insurance. And if they agree to charge government-approved rates, they get some of their Social Security
Malpractice is a big thing here in America as a doctor. I mean, maybe rightfully so, I don't know. you know. But as a doctor, I think that's your biggest fear, being sued for malpractice.
taxes waived too, so it's not as much of a difference as it first appears. Funds and budgets are set by the Ministry of Health, which also regulates the number of hospital beds, what equipment is purchased, and how many medical students are trained. The ministry also sets the prices for procedures and drugs and defines priority areas for future focus and spending. It oversees agreements between Social Security and unions, which represent physicians. Doctors can choose to work outside of these agreements, though, and charge more. Patients have total choice of where they go for care and who they see. Because prices and reimbursement are set at a high level, they can go pretty much anywhere. There is some level of gatekeeping, where patients pay less if they get referrals to specialists before they go there. But those referrals aren't
I'm a little bit confused on how much the patients are paying. I thought they didn't pay anything. So, oh man, I'm sorry about being sick. Guys, I live in America. I can't just go get cured. I mean, I could. I really could. Let me be honest once again. If I was to go to the doctor for whatever the heck this is, I'm thinking I probably wouldn't be cured. They'd probably give me just like a cough medicine, and it would cost me like $60. So, I don't know. I might do it.
aren't to specific facilities or physicians, they're just permission to choose what they want. Most people in France pay very little themselves for their health care. After insurance kicks in, doctor visits can cost €1 or less.
What? Whoa, that sent me into a spiraling health crisis. €1. €1? What is even the point of paying anything right at that point? Play.
Stay can run as little as €18 a day, mostly for the room and board. Prescription drugs are like half a euro. All of these together are capped at €50 a year. An interesting aspect
50 a year. Wait,
drugs are like half a euro. All of these together are capped at €50 a year. An interesting
am I understanding? Hold on. Sorry. All right, I'm back. And it's even darker in here now. Imagine that the sun keeps going down. I don't get it. Is it going to come back? I had to let my camera charge. Anyway, did he just say that copays are capped at $50 a year? Or not just copays, but everything? That would be the most insane insurance plan here in America. Max out of pocket $50 a year.
Interesting aspect, they're like half a euro. All of these together are capped at €50 a year. An interesting aspect of the system is that copays are regulated by sickness. People who have chronic conditions have all their copays waived. In other
Wow.
words, people who use the most care in general pay the least.
Wow. That's so mind-blowing. So unintuitive to me.
France also allows pretty impressive access. For instance, it guarantees that cancer patients can get any drug they want, even expensive or experimental ones. As I said in the beginning of this episode, the French love their system. In international surveys, it always kicks butt.
That's cool that they can get experimental stuff. You know, I've always wondered, I don't know if other people wonder this, but it's like if I had some crazy disease and it was like not curable, I think I'd sign up. I would love to be able to sign up to get like the most experimental treatment, like as like a last resort, like just try anything. That would be really cool to actually have that option.
In terms of satisfaction. It also crushes the competition in terms of quality. In almost every international comparison, no matter what methodology you use, France comes out near the top, if not in first place. I've never met and rarely read anyone who has a bad story to tell about their care there. The knock against the French system is
I'm gonna have to find some videos about like actual stories of people's care there.
that it's expensive, and it is compared to lots of other countries. Its $4,118 per person is well above the OECD average of $3,322
That's nowhere near America though, right?
in 2011. But it's nothing compared to the $8,508 we spend in the United States. With respect to spending
That makes me sick.
as a percentage of GDP, France is near the highest in the world at 11.6%. That's beaten only by the Netherlands at 11.9%, and of course the United States at 17.7%. So everyone else in the world may have a genuine case when they claim that France is too expensive. But I laugh at anyone in the United States that says so. Genuinely universal coverage.
I don't get how that's confusing to people. Like people seem confused about that here in America. They say, "Oh, it's too expensive," but it's like to do universal health care. I don't get it. It's just a different type of expense, you know? It's just different people funding it. The government rather than you or the insurance companies.
Comprehensive benefits. Complete
I mean, I understand they do have insurance companies, but you know what I mean.
freedom of choice of providers. Top in the world outcomes. There's a good case to be made that the French have the best healthcare system in the world.
That was an awesome video. Go check out Healthcare Triage. And shout out to France. Damn. I kind of wish I was there right now. You said free home visits? I could have a doc come check me out and I wouldn't have to leave my computer chair. Only an American would think something like that. Maximum lazy. I'm just kidding. Thank you for watching. Man, I'm struggling. I mean, I feel relatively okay. I'm just constant urge to cough. Anyway, I'll see you guys tomorrow. Thanks for watching. Thanks for subscribing. Just thanks. See you tomorrow. Bye.